My name's Laura, I'm 17 years old and I was diagnosed when I was 7 years old. It was very different back when I was diagnosed because diabetes treatment was a lot different. There's a lot of developments that have happened since. The services available have improved a lot as well. And I've been in the children's service for a long time and been in transition for about a year now as well. In the children's service I saw Dr. Fiona Campbell for about the first couple of years because I was only newly diagnosed, and then after that I mostly saw registrars because my control was fairly good, and my mum was really supportive as well with the service, and the team was really supportive as well. If I needed them to go into school to explain to my teachers about my diabetes, they were more than happy to do that and sorted out a lot of issues with the teachers not understanding what was going on in primary school. And then when I went to high school, I was lucky in that the high school has a lot of diabetic kids going through its system, so it was really good in looking after me there as well. And Fiona made sure that it was very easy to make sure that they were looking after me and making sure everything was okay as well. Since going into transition, it has become a lot more independent on me to make sure that I make decisions about my diabetes, such as my basal rate, which is the background insulin, and different bolus regimes, because when you're a teenager your body changes a lot, and so it's often easier for an adult to take control over it, whereas now things have calmed down. It's more on you to say what's wrong, what you think's wrong with things, suggest ideas for change, and they treat you more like adults. So they talk to you as if you're more like a friend in a similar age, rather than, you know, talking more at the parents rather than at you. So it's been really supportive and good. And finding out about the adult service, I'm still a bit unsure because I've not been in transition very long, but it's a lot more like it would be in the adult service, in that you go into the room by yourself, you discuss all your treatments yourself with the nurse or with the doctor, and it just makes it a lot easier on yourself. I think I would do with more information about the adult clinic because I don't know a lot about it. I don't know where it is. I'm not sure where exactly to go and what exactly would happen at adult clinic and how much different it would be in terms of time that they'd be able to spend with you, because in the children's service it's a lot less stretched because there's only usually type 1 patients, whereas in the adult clinic there's type 1 and type 2 patients that they've got to see. And just to get a little bit more information about it. Another anxiety that I have is that because Fiona's a very big campaigner towards getting the pumps, I've had my pump now for 3 years, and another thing is that because my control's good on the pump, whether they'd put me back on the pen thinking that it would be the same, that's the only anxiety that I've got really, is not knowing whether I'd be able to keep my pump or not, because they're expensive. My mum's been really supportive with living with diabetes, making sure that I can do everything that everybody else does, that I've always been to children's parties and had, you know, just tried to keep it as normal as possible with just a little bit more planning, which is how I see it now, because it shouldn't make a difference that I'm diabetic. Yes, it does in some respects, because you've got to tell employers, you've got to, you know, make sure everybody around you is aware, just so, even if it isn't a problem most of the time, just so that they're aware of it. It can be difficult having that conversation with them to say, look, I'm diabetic, I need just to let you know in case something happens, because you don't always want to be different. I don't want to be different to anybody else. I'm very lucky as well that my boyfriend is diabetic, which I met through Wicked, which is a training course for teenagers. At the moment it's on a trial because they're wanting to see whether they can roll it across everywhere in the country, and I would say yes, completely, because it is so different to actually being in clinic. It's a week-long course and you get to explore different issues that you might not want to always ask about, but if it's set, right, here you go, we're going to talk about some social issues to do with diabetes, and they don't judge you for it either. If you say, oh, I did get drunk once, or I've tried drugs or anything like that, they don't judge you for it, they just teach you more educated ways about it and treat you as an adult, which is better, because then you know in the long run what you can do if you did end up in a situation like that, or in social situations where people say, oh, go on, have another drink, but you want to say no, that you know that, yeah, just don't go mental with things like that. It's a really, really good course that refreshes your memory as well, because some things over time they change in different ways of teaching. I've had it for 10 years. And I went on the course to kind of see if there's any updated ways of treating hypos and treating highs as well. And it's just just going to that meant that I could change the way that I treat hypos just a little bit better, so that I don't get high blood sugar afterwards because I've eaten too much or I've drunk too much Lucozade. And it's just small things like that that just refresh your memory. But it's fun because you're around other diabetics. We were all eating and carb counting and giving insulin at the same time, and that's great because normally there's no one around you like that. Over the years I've got an explanation which is scientific enough and then dumb enough at the same time that they understand it. It's not easy to live with, but it's better than a lot of things you've got to live with, so you just carry on as normal.